We're recorded now. Great. Awesome. So today we're going to talk a little bit with Dr. Shelly and Dr. Gudrun about who they are. You're going to get Dr. Shelly's take and kind of Raden Wellness's perspective. Then you'll get Dr. Gudrun's take and Moon Rabbit's perspective. We'll kind of wrap it all up and then we'll open it up for questions. For questions, if you don't mind, please just placing them in the chat. As anything comes up during the presentation, we're not going to stop during for questions, but we'll definitely leave time for questions at the end. So meeting your hosts, I'm so excited to hear everything that they have to say. Dr. Shelly is a Raden Wellness Naturopath Oncologist. She's a woman health specialist and a dietitian. She'll also share more about herself. And Dr. Gudrun is the CEO of and founder of Moon Rabbit Acupuncture, located in Lincoln Park and West Loop. And she is also an acupuncturist. And I should say Raden Wellness is located in Highwood and Lincoln Park. Dr. Shelly, I'm going to mute myself and I'm going to let you take it away.
Okay, thank you so much, everyone. And yeah, as things come up, put everything in the chat box. We're going to get to questions at the end. We're saving a lot of space to have some interactive dialogue. So if you think of something, put it in there. We'll get to it all on the way. So a little about myself for people who haven't met me before. I am a naturopathic physician, which means I went to a 4-year medical school that specializes in integrative medicine. Then I did a residency in integrative oncology at City of Hope, which used to be called CTCA at the location that I was at. I stayed there in a hospital-based practice for about 11 years, and I've been now here at Raden Wellness for about 4 years. So in addition to being a naturopathic physician, I also did additional training to become a dietitian. So those are extra study hours in nutrition so that I could write personalized programs for my patients and be more specific. Some people do really well with having general guidelines like eat more fiber, eat less processed sugar, and other people thrive when you have very specific things. This is how many grams of beans you want to have per day. This is how many grams of olive oil you want to have per day and in what form and not overheated. So that additional work allows me to bring that to my patients as well. And we wanted to have this meeting today because I oftentimes include TCM recommendations and refer for acupuncture really readily, because I don't think that you should be tackling something like cancer diagnosis or cancer survivorship without having all the tools available to help manage side effects and improve vitality. So I'm oftentimes reaching out to acupuncture practitioners to help with that. So I'm really excited that we're doing this pairing today because it fits really naturally in the style of the work that I'm doing. Okay, so next slide. Thank you, Jordan. Okay, so we kind of broke this into 2 areas. We're going to talk about stress in relationship to cancer. And we're also going to talk about sleep. So it seems very intuitive that if people have high stress, that can disturb sleep, or if people have sleep problems chronically, that could cause a more stress response. And that's true. But right now, most of the research is not delineating that very well. They're not saying, okay, here are the people that have stress and sleep problems, or here are the people who have sleep problems so much that it's interfering with their stress response. Instead, these are kind of like separated a bit. So when I'm talking about research today, I'm talking pretty independently about them. Of course, there's going to be overlap, but I want to be clear that I'm representing the research in a way of what actually we know and what we don't know, because in this space, there's a lot of things that we don't know too. Okay, next slide, Jordan. Okay, so people use the word stress all the time. I use the word stress all the time, but there's really 2 distinct types of stress in oncology. Oxidative stress is what you think about when you think about free radicals. That is an atom with some bad behavior, bashing around, causing potentially damage to DNA. Every day, just through normal cell metabolism, everyday life, you're going to have some oxidative stress. That's just a part of how it works. You need some oxidative stress because it helps tell your immune system and your inflammatory response what to do. So you're supposed to have a small amount. But with modern life, increased environmental exposure, we have ionizing radiation, even traveling on an airplane, we can increase the rate of oxidative stress. And if we don't have the body's ability to neutralize that, maybe our glutathione level is low, maybe we don't have enough dietary antioxidants, you can raise oxidative stress to such a point that's causing more damage to DNA, causing more malignancies. So this part is really important. Oxidative stress causing cancer risk. This is a modifiable thing, something that we can measure. We can measure lipid peroxidase. We can look at some measurements of things like glutathione, looking at a person's ability to manage oxidative stress. So that's good. But that's not what I'm talking about today. So most of the lecture today is going to be about emotional stress, so another kind of stress. So that's looking at our response to things in our life, stressors, and it can be something day to day, like work stress or a bothersome relationship. And then there can be major life stressors. And again, in the research, sometimes they pull out that, like loss of a spouse, loss of a child, and they'll study that in the context of cancer recurrence. And other times they're more looking at the day-to-day stress, like work stress, when they're trying to evaluate risk and progression of disease, recurrence, those types of things. Okay, so today we're focusing on the emotional stress. So why does emotional stress contribute to the cancer process? So it does it a couple of different ways. It can increase cortisol levels and catecholamine. So this is the actual nuts and bolts. So you have some organs, something called the HPA axis, hypothalamus, pituitary, adrenals. These things in concert help secrete chemicals that we call hormones and neurotransmitters, so they can send messages to coordinate within your body, responding to things in your everyday life and to things that might happen once in a while, like a car accident or loss of a spouse, something like that. And in this, these are things that we can measure. We can see how a person's body is responding to that stress. What they see in the cancer research is that people who have persistently high levels of cortisol, levels of catecholamine, which are norepinephrine, epinephrine, some people call it noradrenaline, adrenaline, that those people tend to have higher cancer risk, worse outcomes, and increased recurrence. Now, it's not uniform. Certain studies, like for example, in ovarian cancer, there's a lot more research looking at beta blockers, active ovarian cancer, reducing the catecholamines and having a desired effect. So some of that's a bit more specific in certain cancer types, and other are kind of just a little bit more generally. The next piece of it we call psychoneuroimmunological. So that's saying, how do these things overlap? So kind of generally, if you think about mainstream allopathic medicine, you might see a psychologist, you might see a neurologist, you might see an immunologist. What we try to do in this space, in the functional medicine space, is look to see what aspects of a person's health could be changing the conversation among those systems. So I might be asking myself, is there something in this patient's immune system that could be affecting their neurological health? So do they have a chronic virus reactivation? Do they potentially have nutritional deficiency that compromises immune function? And then from the psychology down, I'm looking, is this person have a toxic person in their life, a career that doesn't match their skill set, something that could be so taxing catabolic to them that that is then draining their immune response and their nervous system's ability to react and modulate that response. Okay, so kind of how it's a little bit different looking at the integrative medicine space as opposed to separating into like silos of specialties. Okay, all right, next one, Jordan. So this is something where really recently we're getting a lot more research about how this all works. So 15, 20 years ago, I remember like, researching for the same topic, and it was just very vague. Like they would say, yes, we know stress can increase cancer risk, but we don't know how, and the studies are mixed. And now they've been able to take cell studies and say, oh, look, this chemical messaging is directly binding to the receptor, and then that's turning on signaling that then increases cell division in cancer cell. And then in the indirect way, they've been able to measure responses where in their microenvironment, in the immune system, they see changes, and then those changes send a message, and that message gets to the cancer cell that this is a hospital place to live. And very recently, they've been able to replicate this in mice in such a way that they made this disturbing change in the stress response that then led to these immune changes that knock on the door of a dormant cancer cell, like a cancer stem cell, mouse is in remission, that woke it back up. So a very clear experimental model where you can see this is what we're seeing, and let's see if this happens. Now, fortunately, we're not doing that to humans. We're not going to potentially hurt somebody by doing that same thing, so it's not studied in the same way. But at least we see some mechanisms about how to explain this a little better versus kind of just giving it a blanket statement. Yes, stress is bad for cancer. Okay. So when I'm speaking to a patient who has a cancer diagnosis or a history of cancer, or is at high risk for cancer, maybe they never had cancer, runs in their family, or it's on their radar for some reason, I really want to hear about their life and it's nice to get to know someone outside the medical, like their relationships with people, their passions that they have. So I try to sometimes bring it up in indirect ways, just being chatty, but then get to the heart of the matter maybe more directly if I'm not getting those answers. And I suspect that there's a piece of that involved in their cancer journey. And this can come up by doing a review of systems, like a portion of a visit where I ask about sleep patterns, fatigue, how does that fatigue look in relation to sleep? Are you able to exercise? If you're able to exercise, does it help with your stress response? So understanding where we can make the most impact. So I do still believe in like having a order intervention with the least invasive to most invasive. So I absolutely want people to do diet, nutraceuticals, all the components that help us be well. But if the first answer is removing an obstacle to cure, so not giving a patient something, but removing something that might be a barrier to their healing, that might be the first step before doing those other things. Through diagnostics, which have come a long, long way, we can measure things like cortisol levels. We can look at catecholamine metabolites. There are a few tests to directly measure catecholamines, a little bit more involved too. So there are some ways to keep track on this. And I do this long-term in survivorship. Sometimes you'll ask me, okay, well, I'm 4 years out. Why are you still checking my cortisol level? And I'm like, well, I still want to make sure that the microenvironment that you have within your body is not sending that message, like you saw with that animal study, where it sent a little relay message and said, knock, knock on the door itself. So that's why I'm checking it even years out. We also want to make sure there's not any nutritional deficiencies or blood sugar that could make stress response worse. So say someone has a very high glycemic diet, they're living on refined carbohydrates or all day long, they're like peaks and troughs of their blood sugar. That's really hard because your body wants to be as close to homeostasis as possible. So if your blood sugar is going up and down, it's going to have to secrete catecholamines in response to that to try and regulate some of that because it wants to keep you alive and functioning. So we can do some things to modulate our stress response that are not stress, that are things like our habits can influence stress in an indirect way that's really meaningful, sometimes a lot more meaningful than even these other things that we're talking about as interventions. Okay, next one. Okay, so that was kind of a big overview on stress, and now let's transition a bit to sleep, even though like I said in the beginning of the lecture, there definitely is some kind of overlap here, an intersection. Okay. So when we look at sleep and cancer risk, there in the beginning, there was a lot of discussion on time of sleep. I wrote a lecture similar to this for a nursing conference probably about 10 years ago, and all the studies were focusing on hours. Okay, this 4 hours or night shift work, and night shift work is still really important, but so much focus on number of hours. And it did seem to be like once you got to 6.5 hours, the rate of cancers became pretty even. So it was the people that were sleeping less than 6.5, particularly 4 or less, that had the increased risk. So lots of focus on hours in earlier research looking at sleep and cancer. Now I gotta tell you, it's really kind of shifted where we're talking more about sleep disturbance and regularity of patterns. So much more now, it could be potentially more impactful, not hours, but what time does the patient go to bed? What time do they wake up? Do they wake up during the night and they can't fall back asleep? So more recently, there's a lot more influence on sleep quality. So you'll see a lot of the language is not time of sleep or duration, much more now it's about sleep quality. So that's why I put circadian rhythm down on there, because circadian rhythm, particularly in certain types of cancers, like hormone positive cancers, thyroid cancer, seems to be the case of kidney, bladder. Certain cancers seem particularly sensitive to circadian rhythm changes. So that's why when I'm working with a patient, I say, okay, well, I know that you like to do this on the weekends and do this on weekdays, but can we make those a little closer to each other just because it could potentially relay a benefit because you have the cancer history or you have cancer right now. So I do try to do that work as much as possible. I understand that some occupations like night shift work mandate that someone has an ultra circadian rhythm. The reality is that in some places like the European Union, having night shift work is classified as a carcinogen. So if you get a cancer linked with it, you can even get compensation. So in some places that link is talked about more, like definitely more on the front. And here, I don't think people talk about it nearly as much. And it's like, well, we need to have night shift workers. That is what it is. And I think in some occupations that's true, like people have to be working, but then there's other ones where, like, manufacturing maybe could happen during the day and not as much as night. I'm not gonna get in that aspect so much of it, but I am mentioning it because sometimes working with patients, they feel like they can't do anything else because they've done the night nursing or something like that for so long that's hard to make that adjustment. But I really encourage it because that link is stronger than a lot of the other things in terms of risk. And interestingly, a few people have looked at if someone was a night shift worker, did they report a lot of difficulty with that, like daytime sleepiness or not? And the people who said, oh no, it's no big deal, I get my stuff done when I need to, night shift work's no problem, did not seem to have the increased cancer risk, the people that it was a drain. So kind of something interesting where if someone's a night owl working the night shift may not be as detrimental in the cancer space as if somebody's not a night owl. Okay. And then the last piece on this slide is just the inflammation, which we'll talk about in the subsequent slides. And then the inflammation piece is just that when you don't have the sleep, it can relate to messaging that's pro-inflammatory. Like deep in my philosophy of this is that we are this self-regulating system. We're an organism, part of a bigger organism. We're part of the world. And I think we're meant by design to have this be self-regulatory. If we're living in such a way that's outside of what our intention is, then we'll have a lot more trouble with things like inflammation. So think about this as a totality, just making sure that everything we're doing is as close as possible as how we're intended to be. Sleeping we're intended to sleep, all those types of things. Okay, next slide, Jordan. Okay, and some of this I talked about already. Remember how like there's more emphasis recently, and then looking at increased overall risk. 25 increased overall risk is kind of just a meta-analysis looking at that. And then if you look at the second part, they look to see where it was highest, and I bolded thyroid because there were some thyroid larger studies that saw like 35 to 40% increased risk. So it's really stronger than I'd ever realized with thyroid. I always knew it was potentially linked, but that was much stronger than I'd seen in previous associations. So next slide, Jordan, we're good. And then kind of just another layer talking about this, because a lot of this we talk about is that sleep reactivity is really important, okay? So sleep reactivity means if you go through cancer and you go through the treatments and you have adverse effects from the treatments, how well are you able to adapt to that? So again, like a newer area to look in, but people who had less sleep reactivity were interventions, whether it was counseling and other mind-body interventions or whatever was used to treat that, seem to relay better outcomes. So that sleep reactivity is really important. And that is an important measurement for me too. If someone's going to have night sweats, disturbing their sleep, are we able to improve that? Like, what are we doing with the sleep reactivity so people's resilience is better from the side effects of treatment too? And then just nutrients for sleep so from my world, it's a lot of things like glycine and magnesium. So amino acids and minerals.
Excuse me, could I have a
And we
remote
like to
control of your
sometimes
screen just
check
real quick?
levels of things when we can. Okay. And then of course, acupuncture, which Gudrun's going to talk about.
Let me start again. My name is Gudrun Snyder. I am the CEO and founder of Moon Rapid Acupuncture here in Chicago. I am also a breast cancer survivor. Dr. Shelly is one of the many people on my care team, and I just feel thrilled to be talking to you today about acupuncture, traditional Chinese medicine, and how we view cancer, stress, and sleep, and how we can be helpful. Next slide, Jordan. So from a traditional Chinese medicine perspective, cancer can be created by a couple different conditions. I don't know if everybody here is familiar with the concept of qi, but in traditional Chinese medicine, or TCM, qi is the vital energy of the body. And when qi is flowing smoothly, when it's strong, we feel really good. We can equate qi to something in Western medicine.
I'm riding with my defender win, cause all the members got it out.
We can equate it to something like we can equate it to oxygenation of our tissues. We talk about things. Sorry, guys. So qi and the vital energy of the body. When you have weak qi in your body from a traditional Chinese medicine perspective, that means you can't fight off infections. That's when toxins accumulate in your body. That's when you're feeling super depleted. And then things like cancers can result. Because when your body is unable to fight off these certain infections or maybe these more dangerous cell types, instead of them being swept out by your normal body mechanisms, your qi is so weak that it barely can get rid of the things that even are good for you in your body, that normal functions, right? So that's one of the ways from traditional Chinese medicine perspective that a cancer might result. Then we also talk about stagnation. So stagnation in the body is when you're kind of feeling really slow. I don't know if you've ever had like a giant meal. We call that food stagnation. And then afterwards, your digestion might be sluggish.
You might feel sluggish. Even just sitting in these seats can make us feel like we have stagnation, right? So one of the things I want us to do while we're watching this webinar right now, so we don't feel so stagnant, is literally just like move your body around. I know I can't see all of you, but for those of you who are able to, I want you to stand up, wiggle your body, and get rid of some of that stagnation. Because when your body isn't moving, when your food isn't moving, when your blood isn't moving properly and it's stagnant, that's when these toxins can accumulate. And so then the final thing that we talk about in traditional Chinese medicine is that toxicity that can build up. It's more likely to accumulate in your body. And these toxins can be things like emotions. You can be so filled with either sadness, depression, anger, things like that. And when those emotions build up in your body also starts to accumulate toxins. And we think of that in Chinese medicine perspective is that your qi starts to stagnate, you become stagnant, and it's almost as if your body can't function in the way that it really should. And so then cancer can result. Because traditional Chinese medicine really looks at the body as a whole. And so when you go to see a traditional Chinese medicine practitioner, they're trying to rebalance your body. They're trying to get your qi flowing smoothly. They're trying to reduce your body from having any stagnation and get those toxins to come out. Next slide, Jordan, please. So to reduce the likelihood of getting cancer, treatments in traditional Chinese medicine are focused on those things that we discussed, is boosting your qi. It's trying to make it so that you're strong, that you have that energy. It's like when you get your best night's sleep, right? Is getting rid of stagnation, reducing that toxicity, and then rebalancing anywhere else in the body. When we talk about how to really treat this from a traditional Chinese perspective, this is a 4-year program, right? That you go through traditional Chinese medical school, and trying to all combine it into this short period of time. I'll do my best to explain these concepts. But if you have further questions about like what qi is, how we're really working on it, please do follow up with me because I'm happy to answer any additional questions. Next slide, Jordan, please. So primarily stress is one of the magic things that acupuncture can treat so well, right? Because we talked about how stress can have an impact on whether your cancer recurs, whether you have an initial cancer diagnosis, or just in general, when you're stressed out, you don't feel good. So from a traditional Chinese perspective, stress really functions from the liver. The liver is not the same thing in Western medicine as it is in Eastern medicine. In Eastern medicine, the liver organ is not only something that is inside your body and it helps with all sorts of different functions, but also there's a liver meridian on the body where these are channels through which qi flows. And the liver meridian in the body, as well as the liver organ from a traditional Chinese perspective, governs your body's tendons and your muscles. So when you're feeling really stiff and tense, often we get that way when we're stressed out, that's because you have liver qi stagnation. Also, you might be more irritable. That's liver qi stagnation. So your acupuncturist will actually work on smoothing the flow of liver qi to reduce your stress. Then there's also different ways that stress can manifest from other areas in the body from traditional Chinese medicine. For example, qi and blood stagnation are actually different than liver qi stagnation specifically. When the blood of your body stagnates, and this affects your circulatory system, that's when you're getting those heart palpitations, that's when you're feeling really anxious. And that's a different kind of stress from a TCM perspective than liver qi stress. Liver qi stress, it's like you're grumpy, you're irritable, you're stiff. Whereas when you have blood stagnation, that's when you're like nervous, you're anxious. And so we would work specifically on blood stagnation and how it is affecting your circulatory system and your heart to reduce your stress. And then finally, the spleen. Well, in Western medicine, the spleen has lots of immune functions, right? In Eastern medicine, we focus on the spleen for its digestive functions and also for its ability to remove dampness in the body. And dampness in the body in traditional Chinese medicine is that stagnant feeling that you feel. When you're super stressed and you just don't want to get out of bed, it's often like when you're feeling a little bit more depressed, your body feels heavy, which is a totally different type of stress from a TCM perspective. So when you have spleen issues in TCM, we work to boost the spleen and boost your qi and your yang to help dry you out and lift you up. Next slide, please. So when you have chronic stress and it's impacting the flow of qi in your body, the solution is we use acupuncture and Chinese herbs to help you. And so how does acupuncture actually work? I get this question all the time. So from a Western biomedical perspective, acupuncture works to decrease cortisol, one of the stress hormones, increase dopamine and serotonin, our happy hormones, but then it also works by the things we already discussed, moving the free flow of chi in your body, rebalancing different areas and focusing on the specific area that's your target, right? Because we talked about different kinds of stress, we don't just say, oh, you're stressed out, here's one package solution. We target what specific type of stress you are going through, right? Which I think is so wonderful. It's not like everybody's stress is the same. And in TCM, we treat them very, very differently. So we also use herbs. One of the herbs that we actually use in traditional Chinese medicine is xiaoyaosan, which is specifically targeted at that liver qi stagnation type of stress we talked about, that irritable, that achy muscles feeling. And xiaoyaosan not only helps reduce stress, reduce depression symptoms, studies have actually shown that it is helpful in cancer treatment, specifically for the liver. So it's one of those wonderful things that you can go to your acupuncturist and your herbalist to talk about whether that might be something to add into your wellness routine. Next one. So I mentioned in the beginning that I am a breast cancer survivor. I was diagnosed when I was 31 years old. My daughter had just been born. She was actually 1 year old. I was breastfeeding and I noticed a dimple in my breast. I took action quickly. I went to my physician, I had a mammogram, and I went through surgeries and treatment. And not only did I use Western medicine, I also used Eastern medicine. I used acupuncture, I used herbs, and I really believe by utilizing all the tools in your toolbox that I had as best a recovery as possible, and am almost 8 years from my initial cancer diagnosis and cancer-free, right? So I do think that utilizing all these different tools, finding people like Dr. Shelly, finding people who can be in your toolbox and utilizing all of them is really the way to make yourself as successful as you can be, whether you've had a cancer diagnosis, whether you're in the middle of treatment, or whether you've not had one at all. Having these people in your support system really can make a huge difference. Next slide. So there's been a number of studies that show that acupuncture, TCM, and then traditional Chinese medicine herbs, as well as the other modalities. So a part of TCM training, we also do Qigong, which is loosely translated to skill with energy. I would liken it very similar to Tai Chi, except it's much more meditative and energy focused. So utilizing all these different modalities, whether it's acupuncture, whether it's TCM, whether it's Qigong and Tai Chi, studies have shown not only do they reduce pain associated with treatment, they also can reduce negative emotions, depression, things like that. And they help you have a better quality of life, whether you are during treatment feeling terrible, needing a support system, or overall, your body just really needs that boost. And then finally, I can speak to this myself, that studies have shown that they help prolong survival time. I really believe that I would not have had as good a life and be where I am now without all of the tools that I've used. Next slide. Okay, so when you're going to your acupuncturist, or for those people who are not near an acupuncturist, it's really important that you talk about everything that's going on. Dr. Shelly talked a little bit about this earlier, that like, it's not just the actual medicines that you're taking. It's not just the food. It's talking about what's going on in your life. It's really important to have a whole body system that you're really looking at. What's your job? Is it the right fit for you? And talking to whoever your healthcare providers about setting yourself up for success, right? It's super important to utilize, again, the food you're eating, the people in your life, and then also all of these other tools so that you can have as stress-free an experience as possible. Next slide. Okay, so sleep from a traditional Chinese medicine perspective is so important. Traditional Chinese medicine really follows a seasonal point of view. So like in the winter, you should be getting more sleep than you are in the summer, right? There's more light, you should be out, you should be active during the day, and following that seasonality can be a really helpful tool for people because they often feel like, I'm so tired in the winter, it's so dark. It's actually because our bodies from a traditional Chinese medicine perspective need a little bit more hibernating. We need a little bit more of that restoration time because our bodies during that yin season need to rest, need to be quiet, need to have that meditative moment to get ourselves boosted up so that we can be our best selves during the spring. So one of the things that we talk about is the different types of difficulty sleeping. Everybody's different when you have different sleep disturbances, right? There's the people who have a hard time falling asleep. Those people have something called spleen and kidney deficiency. And I'm not going to go deeply into like what exactly that means because that would take days upon hours, but essentially your kidney is a part of your body that helps quiet you down. Your spleen is the part of your body in Chinese medicine that activates your mind. It's like when you're studying for a test, we say that they're really like using their spleen. So if you have this disharmony where your spleen and kidney aren't as functional as they should be in traditional Chinese medicine, you're gonna have a hard time falling asleep. You get in bed, you can't stop thinking. It's like you're ruminating thoughts. Those people, we treat specifically their spleen and kidneys with the acupuncture. Then there are the people who have like this fitful tossing and turning sleep where they like cannot stay asleep. They might be able to fall asleep initially, then they wake up and they're too hot or they're too cold. That from a traditional Chinese medicine perspective is the heart and kidney not communicating. The heart is hot, the kidney's cool. And so when one of them is like overbearing the other one, the heart might be too hot and that's why you're having night sweats. But then it also might be too cold with your kidneys later and that's why you have cold feet. So in traditional Chinese medicine, we work to get them, the heart and kidneys, to communicate again so you can stay asleep for the whole night. Then we also had that irritation sleep where like you're really grumpy about something and you've kind of been grumpy all day and you can't stop thinking about it. Maybe you fall asleep, maybe you can't, but then you wake up, you're still grumpy. That is that qi stagnation, that liver qi stagnation that we talked about before. Then there's the people who like wake up. I wake up at 1 o'clock every night and I can't seem to fall back asleep. Specifically in traditional Chinese medicine, we're going to talk a little bit more about this in a second, is that there are different hours that are associated with different organs. So if someone comes to me and says, I wake up every night at 2 o'clock in the morning, to me that says that's the liver time. That's the time of the night where we have to focus on the liver. And so we do a specific liver focused treatment. And then finally, people who just like can't sleep at all. These are people who really have complete insomnia. They're exhausted during the day. We do a complete body reset with their qi, with their yin, their yang, their fluids, everything to get them back on track. Next slide. So I just mentioned this a few minutes ago, but for people who are always waking at a certain time of night, we have different times associated with different organ systems in traditional Chinese medicine. So people who wake up between 9 and 11 p.m. often have disharmony in their Sanjiao channel or the Sanjiao organ, which isn't a real organ in Western medicine. It's something that in Chinese medicine we think of for digestion. These are the people who also have a hard time letting go of things, whether that's letting go of food and they often get constipated. They are people who have a hard time letting go of maybe injustices that have been done to them. And then they're just so focused on it. So one of the mantras that I give to people who always wake up during this time period is I am safe, I can let go, I can allow myself to relax. The next time period that people often wake is between 11 p.m. and 1 a.m., and that's the gallbladder time. The gallbladder channel runs from the outside of your eyes, around your ears, and down your body. The gallbladder not only has importance during making decisions, but it's also about how we view ourselves and the world. So this is something that people who are very judgmental on themselves or others often wake during this time period. And a mantra that we can say for them is I reach out with kindness and forgiveness towards myself and towards the people around me. Then we have the liver time. This is a super common time, right? 1 and 3 a.m., which makes sense in the context of everything I've said before, that the liver controls irritability, anger, tension, things like that. And so for the liver, we say, because it's so focused on anger, it's that you say, I love and I like myself, I accept myself as I am, and I'm kind to myself. Then there's the lungs, which is between 3 and 5 a.m. These are people who've often gone through grief and trauma, things like that. And so for the grief and trauma, this is a time that you have to be really kind to yourself. And a good mantra for that is I have faith that things will work out and I can let go of my sadness and exhale. Finally, the large intestine time, which actually should be 5 a.m. to 7 a.m. I apologize if the slides are incorrect. And so the large intestine time, that also happens to do with digestion, where you're constipated, you're having difficulty letting go. You might have other digestive issues such as reflux, upset, things like that. And so for the large intestine, we also need to release whatever is not serving you anymore. So we say, I release whatever's not serving me. I'm allowing people around me to be who they really are. And I'm allowing myself to let go and make space for the new and the healthy. Next slide, Jordan. So after hearing all of this from the TCM perspective, what it means, what is chi, how we look at stress, how we look at sleep. The thing is, like, what do you do with that information, right? Like, here's our perspective, here's how we view it. But the thing is, if you are someone who's stressed out, if you are someone who is having difficulty sleeping, first, if you have an acupuncturist near you, great. If you don't have an acupuncturist near you, which can happen a lot, there are other tools that you can utilize, such as Tai Chi, such as Qigong that I mentioned. These things are readily available. Either you can go to Moon Rabbit's website. There's also YouTube videos online, because what you're really trying to focus on not only is centering yourself, but is that smooth flow of Qi in your body, right? Reduce that stagnation, allow your body to get rid of toxins. And in the dream world, you go see your acupuncturist and we can help you and be your support system, but there are things you can be doing at home on your own. I just want to thank you all so much for having me. And now we'll open up for questions.
All right. Thank you all for bearing with us. I did close the meeting, so no one else could come in. All right. So a few questions. Continue to place them into the chat. But someone asked about sleep, and what about 6 a.m. if they go to bed around 1 a.m. and they wake up around 6 a.m.?
Sure. So I know that the slide was incorrect with the time, but again, that's the large intestine time. I'm not sure if this is true for you, but that's usually people who are waking around that time have digestive issues. Maybe that's not necessarily the case. Maybe it's more of an emotional thing where you're like not letting go of something, or there's something that you're holding on to right before bedtime that you really need to make sure you let go of. This can be something small. This can be a to-do, right? This could be a to-do that you're like, oh, I'm not, and you're obsessing about it. You haven't taken care of it, but make sure you let go of it emotionally before you go to sleep, because otherwise you're going to wake up early, and you don't have to wake up early. Another thing, though, that is important to keep in mind, at least from a traditional Chinese medicine perspective, I think it's really important to remember everything I say is traditional Chinese medicine, and I always defer to your physician for what they think from a Western medicine perspective. Everybody needs a different amount of sleep. You know, there's that recommended get your 8 hours a night, but from what I've seen and from traditional Chinese medicine is that everybody needs a different amount. So if you're waking and feeling rested at 6 a.m., great. Don't feel bad about that. But if you're not feeling rested, then that's when you need to really reassess and figure out what is going on with your body and what disharmony there is.
Awesome. Thank you. And then we have a few questions on the herb that you mentioned for the liver.
It's called Xiaoyasan. Now, I always recommend when taking any herbs or any supplements, you should do it under medical supervision, whether that is your physician, whether that is your acupuncturist. And I really recommend, if you are going to take a traditional Chinese medicine herb, you should see a real board certified herbalist, because it might have an interaction with something else that you're taking, and you really have to be careful. These herbs are powerful, and it's important to make sure that you have someone paying attention to all the things you have going on.
And then can you repeat the Sun Jiao explanation?
Oh, yeah. So the Sanjiao time, which was, I think it's 9 p.m. to 11 p.m., when you're really having difficulties either falling asleep or staying asleep at that time. So the Sanjiao is not a real organ. In traditional Chinese medicine, it's kind of like this amalgamation of a few different organs. It's also called the triple burner. It happens to do with digestion, acid reflux, keeping your body warm, the transformation and transportation of fluids in your body. And so people who have difficulties with that time is usually because they're having trouble either letting go of something, having trouble with keeping things down. Maybe it's something that they're feeling unsafe in their body sometimes with the Sanjiao, because in the Sanjiao, it can kind of feel like they're overflowing and they don't have control of their body. So we say, I am safe, I can let go, I can feel good in my body.
I'm gonna ask two questions for the both of you. If someone's told that they can't do acupuncture during acute cancer, why? And maybe both of you have that. And then thoughts on a loss of flexibility in the body and cancer. Can it be a sign of chi blockage? Would acupuncture help?
Dr. Shelly, do you want to go first?
Yeah, I think the not doing acupuncture during active treatment is not over the tumor area. So we don't love if someone has a tumor surface to needle the actual area of tumor. It's kind of debate about whether you could induce metastasis by disrupting the the actual lesion. So no acupuncture over the actual tumor site. So that's usually what I've heard as far as why not to do an active treatment.
I will concur. I think that the only other time is when you're in a super, super weakened state and you're so depleted already that really adding anything else, it's really not the time. It's time to rest and restore. Though I have heard it very, very rare where a medical provider will say that acupuncture is not really suited for you at this time. And all the acupuncturists that you go to should be board certified, licensed. They will know what to do if you are undergoing active cancer treatment, as long as you are going to one of those individuals.
And you can speak to this too, Gudrun, is that there is a way in your technique too, where you can have a more subtle response or a kind of more aggressive treatment. And if somebody has experience working with cancer patients, they understand that and they will personalize your treatment to that.
That's exactly right. And acupuncture is always personalized, right? It's always going to meet you where you are. But just like Dr. Shelly said, is that your acupuncturist is going to be able to know, like, if you're undergoing, you have some sort of issue, especially if there's an open wound area or things like that, we're not going to go near it. We are absolutely going to make sure that you're protected and safe. But we always defer to your medical provider because perhaps they have another reasoning that we're unaware of, right? And then I forget the second part of the question.
It was just about loss of flexibility. Do you have any thoughts on a loss of flexibility in the body from a formerly flexible person and cancer, someone who regularly practiced yoga? Can that be a sign of chi blockage, and would acupuncture help? And specifically, speaking to loss of flexibility in the hips.
So the answer is maybe. It really depends. So for someone like you who maybe has this loss of flexibility, we would ask a lot of different questions about what's going on, right? And your history, everything else. This is the moment where like your acupuncturist might like look at your tongue, feel your pulse. And it could be an example of chi blockage. It could be an example of chi stagnation, but it also just might be at the level of like the physical part of your body, right? There's lots of reasons why we have certain reactions to treatments. And so again, it's important to work with your Western medical provider as well as your Eastern medicine provider, but it's absolutely worth a consultation if you're nearby an acupuncture provider to see if it might be helpful.
Then we've got some questions on, would acupuncture help with digestive issues that were a result of Whipple surgery from pancreas cancer? And then also, can acupuncture help heal an overactive nervous system?
So the tricky thing about acupuncture, as with everything, is that nothing's guaranteed, right? For some people, they are incredibly responsive to acupuncture and it can be a miracle, right? But for other people, it doesn't really help. So again, for both of those questions, it's really personalized for you. And my recommendation would be to meet with an acupuncturist in person. It would absolutely be worth the time because the possibility is real that it could be significantly helpful, but I wouldn't know unless seeing you in person, learning a little bit more specifically about your case and what's going on.
Is there anything available in both of your worlds for GI reflux?
Yes, there's a lot of things in this integrative medicine space. You can use digestive enzymes, demulcent soothing botanicals, avoiding dietary triggers. So many things, eating smaller, easier to digest meals that you chew more thoroughly, being conscientious of things that are spicy, potentially be irritants from contact irritation. So lots of things from our space can do to help with that.
And ditto for TCM, acupuncture can be magical for acid reflux. Sometimes we have to use herbs, but not always. But then I have some patients who have had acid reflux and I do all the things that work for my other patients and it's still there. So again, it's so personalized to each person, but we have these wonderful stories and anecdotes and even studies to back us up now that acid reflux can be treated successfully with acupuncture, but it's each individual is very different.
And then how do you spell Shiasan? I believe that was one of the herbs.
It's Xiaoyasan. It's Xiaoyaosan, Xiaoyasan. Don't order it online. Wait to see an herbalist. Absolutely read about it. And one of the reasons why I say don't order online, other than you want to like meet with a board certified herbalist, make sure it's right for you, is that some of these Chinese herbs are contaminated with heavy metals. It is super important to find that they are sourced well. And so like when you go to a place like Moon Rabbit or other places that have real herbalists on staff, we're going to be very careful about where we get the herbs that we give to you.
Any other questions? I don't see any in the chat, but Dr. Shelly and Dr. Gudrun, if you want to kind of close us out. Before we totally close out, everyone will get a recording to this. Please give us 24 hours because I'm going to go in and cut out the fun we had a little bit. So give us 24 hours to send it, but you will get a recording of this as well as the presentation. But Dr. Shelly, Dr. Gudrun, if you want to kind of close us out with any remarks.
Just that one of the main reasons we want to choose this topic is it's something that's really glossed over. It's just not properly addressed in mainstream office visits. And I think it's so important in the long term when you're looking at measurements of outcome and quality of life, and just very glossed over. And then it's also a space where it's just so linked, I find, acupuncture. So I'm love that we're able to speak to this in a way that's very complete, that hopefully everyone can take away something today and learn something.
I want to echo what Dr. Shelly said. I think it's just so important to focus on your mental health, focus on things like resting and self-care, because when you're going through something that rocks your whole world, you really need to be paying attention to it because it can affect your entire treatment and actually like what happens next, right? So I want to thank Dr. Shelly for being here, for being on my care team. I want to thank all of you for being here and having an open mind about traditional Chinese medicine. As I said, it's not one size fits all. It doesn't work for everybody, but for some people, it can be magical. I know for myself, it has been. If you have further questions, I know like we threw a lot at you. Please know that I'm here. You can reach out to Moon Rabbit. If you're in the area, please come in, say hello. And I hope to see you all on another webinar without the trolls.
No trolls next time.
That's right.
We're gonna figure that out, how to make it more, I don't know, password extreme. So thank you all so much and have a wonderful Wednesday.